Dr. Katzen.
Good morning, how are you? So today we have a wonderful patient from the East Coast who lost about 160 pounds, and what we're going to be doing is a 360 circumferential lower body lift, getting rid of the excess skin and fat of the tummy, hips, and backside. So we're really going to hit the love handles on the backside here by making the incision high here over the hip and getting rid of the excess skin and fat there by lifting the buttock up. So on the backside we're going to pull this, we're going to have the incision here and pull this up, and on the front side with the tummy tuck we're going to pull things down. So there's also, we're going to continue down to the pubic region, raise and reduce that region, as well as a vertical medial thigh lift with an incision from the groin down to the knee, getting rid of a pretty good amount of excess skin and fat on the inner thigh. And let's go to the operating room and I'll show you how we do it. So dissecting down the flap here, and we're going to bring everything back together. Here's external obliques. Here's the gluteus maximus muscle. Now you can see this, the love handles now are gone, and we get this nice definition between the thorax and the pelvis. You can see his pelvic bone's pretty high. The top of the superior iliac crest is right about there. There's the posterior rim. So there's the bone, and here's the muscle that sort of meets the pelvic bone. So pretty narrow waistline, but we want to get that much more defined and chiseled for him. So that's going to come there, that's going to come there, there, we're all good. Okay? Very good. So I'm going to do the same thing other side. So now we're going to get the blood out of the flap. Instead of just cutting it out, we lose all the blood. So instead what we're going to do is we're going to wrap the specimen here with this. This is called a stockinette. We often use this in orthopedic procedures. And we use a little top clamp. So this allows this is called co-band. This is like a really tight ace bandage. And I'm going to squeeze all this blood that's in this flap back into the circulation so we don't lose all this blood. So it's an extra step. Yeah, it takes a little bit more time, but in my opinion, it's worth it. Minimizes blood loss, minimizes the necessity for a blood transfusion. So I combine this with an iron transfusion. Iron goes through the IV, so while they're asleep, we're replenishing their iron stores. So iron is the building block for hemoglobin. Hemoglobin is the molecule that carries oxygen throughout the body and helps you heal. So if you don't have enough hemoglobin or don't have enough iron, you're not going to heal optimally. So this helps to minimize the blood loss. There you go. And that's the stockinette. Looks kind of weird, but it definitely does work, and we've been doing it for years. Okay. So we're done on the back side here. Again, I made my incision high. I went down to the fascia, scooted down the buttock, lifted up the buttock, and also primarily removed the love handles. So remember those love handles on the side right here? Those are all gone. They're in these little specimen containers here. So he has a nice V-shaped torso going down to his waistline and out to the buttocks. So I think he has an excellent result here. Now I'm just going to flip him over and do the front side, basically, and that's an extended tummy tuck, getting rid of extra skin on the tummy, hips, plicating the muscle, lifting and reducing the pubic region, and reorienting the belly buttons. There. I'm going to make my incision not just underneath the abdominal flap. I'm going to make it low in the pubic region here to raise and reduce the pubic region. So we're going to start here. Did my rectus plication here again. Those that two paired muscles here, the rectus abdominis connecting the rib cage to your pelvic bone, and we imbricated it, taking the lateral border to the other lateral border and brought it together and imbricated it like that with 2 layers of permanent suture from the sternum to the top of the belly button to the top of the pubic region, and then a second layer of a running permanent suture from the xiphoid to the pubic region. So super flat tummy. You saw we brought it in about 4, maybe 5 inches, nice and flat here. You could bounce a surgical quarter off it. And now we're just going to re-drape it with this excess skin and fat on top. Now we're going to drape here. So one thing that's missing on the anterior abdominal wall now is the belly button. So we've shifted everything down, we repaired the muscle, we brought the flap down, we've anchored it, and now I've just got to center up the belly button. So the center of the belly button is going to be in this midline. This is the vertical line. Now his belly button is going to be at the top of the iliac crest here. It's the hip pelvic bone. Boom, right there. So top of the pelvic bone again, superiliac crest, boom, that's 6 o'clock on everyone's belly button. Now we play a game called Surgical Go Fish, 15 leg. Sounds good. Blood is good, that means that this abdominal flap has a good blood supply. So we're done. I did the front side here, completing the 360 circumferential lower body lift. Nice flat tummy, no vertical incision needed, no fleur-de-lis. So we took the skin that was above the belly button, brought it down to the pubic region, eliminated the skin from the anterior abdominal wall, the hip region, the love handles, and the top of the buttock. There's a much better shape now, V-cut, nice flat abdomen. We can continue the incision down, medial thighs from the groin down to the knee. Nice skinny thighs, no excess on the inner thighs. The thigh's not going to rub anymore, and it's going to really show off his quads. So that's how we do a 360 lower body lift combined with a vertical medial thigh reduction on a male patient that lost about 160 pounds. Thanks for watching. Please subscribe. We'll see you next time.